Have a look at this clinical question. Okay, that's time. Please select your answer in the poll. While you're selecting your answer, just a quick recap of the key features here. So, this patient's presented because they're getting muscle weakness and fatigue, which is getting worse. Note that it gets worse as the day goes on. And some of the specific things, holding up their head, brushing their hair, even just chewing, doesn't seem like that strenuous, right? And when they rest, it improves a little bit. No recent infections or anything, no family history of note, but they were started on a statin 6 months ago. Okay, great. So well done. Most of you got this right. The correct answer is E, myasthenia gravis. Okay. The other two popular answers were giant cell arteritis and Guillain-Barré syndrome. A couple of things that make these less likely. When it says what's the single most likely diagnosis, for those of you doing exams, bit of exam technique, and that is that sometimes more than one thing can clinically fit the picture. And if more than one thing clinically fits the picture, the one that's the most likely is the one that's more common. Now, sometimes something quite rare will still be the single most likely because it fits better than any of the others. So what makes giant cell arteritis less likely for this one? What would be a really important feature that if it was there, that might make you think, okay, you know what, maybe I'd be leaning more towards giant cell. So a couple of things. So one is that there's no pain, there's no headache. They had headache, and then 52 is quite young. You can't get it at that age. But, if they were sort of late 60s, 70s, and they had a headache, okay, then I'd probably lean more towards giant cell arteritis, okay? And then what makes Guillain-Barré less likely? When do we typically see that? And what's the other name? What's it sometimes called? So often, before someone has developed a feature of Guillain-Barré, is that they would have had an infection recently, right? They've not had any of that, but it's also known as the ascending paralysis. It tends to start low down and then spread upwards, right? The weakness starts lower down and then spread upwards. They've already got it like chewing during meals. Doesn't mention anything about the lower limbs. Do you see? What feature might make us think, oh, I'll be thinking about Horner's? That's not mentioned here. Yeah. So eye symptoms like ptosis, right? And then MS, what kinds of things might we see? Because in MS, you can often get very tired, but you wouldn't necessarily have things like difficulty when you're chewing meals. What you might see though is, like sometimes you might get things like changes in vision. You might get things like that it comes and goes. They have periods where it gets better, then periods where it gets worse, and so on. Okay. So why does myasthenia gravis fit? It's not just the symptoms. One of the key things is atorvastatin. Remember, today we're talking about drug safety, right? So one of the recent MHRA alerts was relating to statins, that there's been a small number of cases of either new onset or aggravation of existing myasthenia gravis with these statins. So atorvastatin, the most commonly prescribed statin, is one of them, but all of these were mentioned. So it's now recommended that when you're first prescribing someone a statin, that you make them aware of the symptoms of myasthenia gravis, and that if they get any of those symptoms, to get help. What's the other key side effect that we tend to warn people about? What's a relatively common but important side effect with statins? Yeah, rhabdomyolysis, right? So you warn them about getting sort of muscle aches and pains, right? But in terms of myasthenia gravis, it's rare. It's an autoimmune long-term chronic condition. So what you get is this weakness. So voluntary muscles, so things like eye movement, facial expression, speaking, swallowing, limb movement, even breathing. So you can get a range of symptoms. So it can affect the eyelids, you can get sort of double vision, you can get simple things when they're repeated, they get sort of extreme fatigability. So chewing, chewing 4 or 5 times, suddenly they're really tired of it. Speech disturbance, okay, weakness of the limb, shortness of breath. And there are a few other drugs that have shown an association with myasthenia gravis. So some antibiotics, so fluoroquinolones, macrolides, aminoglycosides, 3 different types of antibiotics, and then beta blockers. Okay. Anyone know the test for myasthenia gravis? Or one of the tests that we can do for myasthenia gravis? Like if you suspected it and you wanted to do the test for it. The Tensilon test. Yeah, well done. So get them to repeat the same phrase. A good one is 99. Okay. And you count how many times they can do it. 99, 99, 99. Because they get that fatigability, you count how many times, then you give them the Tensilon, and then you repeat it shortly afterwards, and you'll see that the number will improve. And so then you've confirmed the diagnosis. Hope you found that helpful. Please do subscribe to the channel, like and share with your colleagues if you'd like more content.